Welcome. We're happy to have you guys join us this afternoon for a short webinar around using the Missouri COVID-19 dashboard on all things Missouri to really better understand economic and social impacts that we're seeing currently. So I'm Jamie Kleinsorge, and I'm joined by two of my colleagues from CARES, Sam Tennant and Justin Crone. And we're going to be going through some of the pieces of the dashboard today. So a couple of housekeeping items first. We do have everybody on mute. So if you do have a question or would like to speak with us, feel free to use the chat. We will leave time at the end for questions. So you're welcome to submit questions during the presentation or there towards the end. Also, we are recording this session, so we will make the recording available to you and to others who maybe weren't able to join today. So with that, I will go ahead and get started. So we are going to be using slides today to demonstrate some of our tools, just because we're all getting a little, having a little trouble with bandwidth, and which reminds me, I'm going to go ahead and turn off my video, and I know that others have turned off their videos as well, so hopefully the audio quality will be pretty clear. So we're going to be exploring all things Missouri today, so if you want to follow along, it'll be allthingsmissouri.org, and what you'll see here on the home page is this big red button, right, that says COVID-19 tools and resources. And so the resources that are available within that resource section include a couple of different items that we're going to be talking about today. So Sam, if you could go to the next slide. Here's an example then of the tools that we have sort of in this suite of COVID-related tools. And so what you're seeing here, the first one is an interactive report. We're not going to be demonstrating that today, but basically you can select your county. You can get a couple of COVID-related indicators to report for your county, along with some other social determinants of health that we've selected. We did a webinar, and we'll be posting that last week on the vulnerability footprint. We may do another one of those in the future, and that tool is really looking at the intersection of three indicators that we consider to help us identify the most vulnerable populations related to the COVID-19 pandemic. And those include folks that are over the age of 65, those that are uninsured, and then we also have an indicator around population density, noting that folks that live in more urban or population dense areas have a greater vulnerability of getting the disease. We also have a story map, which takes you through some of the indicators that we'll be highlighting today, as well as a starter map gallery with some of those, again, COVID-related indicators, including daily counts, as well as additional layers like the ability to add hospitals and other points of interest, maybe like public schools on top of some of those layers. Finally, we're going to be doing the COVID-19 dashboard today. And so, Sam, yeah, go ahead and click to the next slide. This is where you'll land. And I actually made an error that at the top that should say Missouri COVID-19 dashboard, because this tool will get you right to that state of Missouri, as you're seeing here. So we are populating data similar to the national COVID-19 dashboard that we have available on our engagement network. But the exciting thing about the Missouri dashboard is that we have been able to pull in some specific Missouri indicators. So rather than just reporting on, for example, the Medicaid and Medicare population for some of our health-related indicators, we've been able to get more local, state-level information to report for the state of Missouri. So what you'll see on this Missouri dashboard and in this Missouri map are just basically the cases, confirmed cases by county. So those larger red dots are going to indicate more cases. Smaller red dots indicate a fewer number of cases. And then we do have a few counties that have not experienced any cases yet. We also have a the death count, which is being updated pretty regularly, as well as those confirmed cases. So we do have data feeds for both of those coming in from Johns Hopkins. And again, we do have some local sources in other places. Within this tool, you can click on a county either on the map or on that right-hand side where you see the county name listed. Here you'll see St. Louis City, Kansas City. Those are going to be those top counties that have the most cases currently. But as you scroll down that list, you'll be able to find your county and click on that. It'll zoom right in there for you. As you can see in that little pop-out box, then you can get the number of confirmed cases for the county. Here we're looking at Jackson and the total number of deaths. So really just a very focused current count dashboard for Missouri. So the next part of the COVID-19 dashboard is looking at another map of Missouri. And really this is looking at two different indicators. The first one being the total number of confirmed cases, which you see there in blue, and then the total number of cases per 100,000 people, which you see there in an orangish reddish color, right? And you'll notice there in the middle, there's a gray bar, and that's what we call our slider tool. And so you're able to sort of slide back and forth across the state of Missouri to view both of those indicators at the same time, both of those layers at the same time. And what's interesting or important to note here about this, about what this map is showing us, is that the number of confirmed cases, we can see that, but we're looking at also the rate per 100,000 people. And this is very telling when it comes to thinking about those rural areas. We know that in Missouri specifically, we have had some areas, rural areas that have been impacted or hit a little bit harder. And why that's important is because they're going to have a harder time or more stress, right, on their healthcare system because they don't have the capacity, right, as a larger area, a more populous area. And so we're seeing those as we slide back and forth in the live tool, that there are some counties where the confirmed cases are lower. And you can kind of see that right at that line where Jefferson City is showing somewhere between, I think, 21 and 50, or sorry, Cole County. But when you look at the cases per 100,000 people, so the rate at which that county is getting cases, it is much higher. So that is an area of concern. You can also click on these counties and get more information, as I've done here on the right-hand side for Saline County. So it just allows you to dive in a little bit deeper. So I'm going to turn it over to Sam now, who's going to talk about some of the vulnerability indicators that we have available in this dashboard.
Yeah, so on the dashboard itself, there are tabs at the bottom to filter through the different vulnerability indicators. So there are demographics, economics, health, and mobility indicators, each with its own tab. But starting here with the demographic vulnerability indicators, you'll want to select your county from the drop-down list in the top right section of the dashboard. So as you can see, for this particular subset of data, it is for Atchison County. So for instance, we can see in Atchison County, there are only 2 total cases of COVID-19, and directly underneath that, we get the value for the whole state of Missouri to make a quick comparison. You can see that's how it's laid out for each indicator. These values in gray, which are total cases, deaths, cases per 100,000 people, and deaths per 100,000, will be on each of the vulnerability tabs. Specific to demographics, we have total population within Atchison County, the median age, which is 48.3, total households, and the percentage of the population that is disabled. On the right is a bar graph of the age distribution and the values associated with it. The pink bar on the far right is age 65 plus, which seems to be the majority in Atchison County. This will help assess the layout of your county in regards to vulnerability to COVID-19. So since there are a large number of demographics who are more susceptible to complications, we think it's valuable to know the layout of hospital beds as well, so you can analyze the preparedness of your specific county. So in the bottom blue indicators, we have licensed beds, staffed beds, ICU beds, as well as typical bed utilization rate, which is 34.2%, which means the average rate at which those beds are usually taken, as well as ICU beds per 100,000. So this gives you a total snapshot of each county's demographic vulnerability. This is still demographic vulnerability indicators, but this specific use case is in Benton County. And as you can see in the bottom where those blue hospital rates, there are no rural hospitals. So luckily, their total cases and deaths are extremely low, but also a higher number of older population. So this may help you recognize or explore your telehealth and collaboration ideas. Do you know who you could contact? There are many institutions switching to telehealth or creating spaces where you can utilize something like telehealth if you live too far from a hospital. And most of this data itself has come from, the COVID-19 cases have come from the Johns Hopkins University and are updated daily, as well as the hospital beds are from the Definitive Healthcare in 2020. So I'm going to hop to the next one, which is the economic vulnerability. So this is specific to Taney County. As you can see from the county selection in the top right, we have those same gray indicators from before with Taney County data, which they also have low counts. Some of the indicators in here include percent of the population in poverty, percent of population uninsured, the percentage of internet usage at broadband speeds in green, households with no internet, which is 15.9%. So even applying for unemployment or utilizing telehealth won't be an option for some in this county. We have unemployment rate, median household income, and GDP in Taney County. This bar graph on the right is the different job sectors in the county. So that green bar shooting to the top is arts, recreation, entertainment, and food services, which I thought was really interesting. And then I recognized that this is the Branson area, so that kind of makes sense. But this page gives a snapshot of the economic standings per county and some of the issues that might come up in recovery as well. So this is important from a decision-making standpoint to see which industries will be affected the most, how much of the population has restricted internet capabilities for working remote or filing for unemployment, as well as the economic standing in terms of recovery. Our broadband usage data is from Microsoft, and our unemployment data is from the Bureau of Labor Statistics and is updated monthly. So next we have our health indicators. So under the health vulnerability indicators, these are for St. Genevieve County. So these include the health indicators for those at higher risk of complications for COVID-19 defined by the CDC. So we have percent of adults who smoke, percentage of the population with high blood pressure, percent with diabetes, percent with cholesterol, percent with asthma, and the percent with cardiovascular disease or angina. So this paired with some of the hospital bed information is critical to understanding how affected your county will be if COVID were to spread. But luckily these cases are low, and even some of the indicators are low as well. And so our last tab is going to be the mobility indicators. So this is specific to Platte County. And these county mobility changes are calculated from Google using anonymized location data and aggregated to the county level. So percent change is calculated from the baseline average of pre-COVID-19 movement. A value of 0.0% change indicates not enough data was available and calculations were not made for that indicator. So on this page, specifically in Platte County, we see that Parks mobility in green is at 0.0%. That just means there wasn't enough data available to make that calculation. But these indicators include retail mobility, grocery mobility, workplace, parks, transit, and residential. So with each of these values, if they are negative, like retail, workplace, and transit, that means the movement to that place has decreased. If it's positive, they are in those places more than they were. So we can see here grocery and residential mobility are at an increase. This is important to understand that when people aren't moving in community, that means less money is spent. So we can see a decrease in retail and workplace, which means people aren't going out and buying coffee or lunch. And the increase in grocery mobility could be due to some food insecurity happening within this county. So next, I'm going to turn this over to Justin, and he's going to talk a little bit about our testing dashboard.
Thanks, Sam. So this testing dashboard is a separate dashboard. The purpose of this is to kind of give an idea of where each state stands as far as testing. We've heard a lot in the news about cases increasing or decreasing or being steady, but the real crux of the matter is testing. So states might have a steady stream of cases, but maybe they're not testing as much as they should be. So the idea of this dashboard is to give decision makers the tools to see where their state stands as far as testing. This first map shows the cumulative positive percent tests for each state. So that's the number of tests that are positive divided by the total amount of tests taken. So all those states that are in deep blue, those have a test rate of below 10%. So that is the official guideline. If you have a testing rate below 10%, that means that you are testing enough people to have kind of a hold on the new cases that are coming into the state. So states are aiming for a 10% threshold. So you can see about half of the states meet that threshold right now for the cumulative total. So right here we have Missouri showed up on the left, and you can see the counts for the total number of tests, the total number of positive tests. And then on the left-hand side, we have the cumulative totals. And on the right-hand side, we have a rolling average. So for the total tests, there's been a total of 18.9 tests per 1,000 people from the beginning of the pandemic up to May 11th when this data was updated. The 7-day average takes the average number of tests from the last 7 days divided by the population. So here we have 0.56. The CDC recommends a 7-day average of 1.52. So you can see that we are significantly below the CDC guidelines for what they, or sorry, it's not CDC, it's Harvard. What the Harvard study recommends the number of tests given per day should be. So we are significantly below that. But you can see the total positive tests for the state is at 8.6%. And the 14-day average, which is the White House guidelines, they want to see the average for the last 14 days below 10%. So we definitely hit that mark at least. So we are 6.2% in the last 14 days. But again, we're not testing enough. So Sam, if you can go to the next slide. This is a map of the cumulative testing totals. So you can see Missouri is in the bottom quartile for number of tests per 1,000 people. Other states like New York and New Jersey, they've had enormous outbreaks, so they've been testing a lot of people. So their tests per 1,000 people have been a little bit higher. But you can see other states like North Dakota, New Mexico, and Utah that may not be as populated, but they have at least enough tests or more tests per 1,000 people. And so this, if you you can flip back and forth between these two maps, and you can see a pretty stark difference between all those states that are really dark blue in the first map, and then they show up pretty dark orange here. So you can see that even if they're below the 10% threshold, they're still not testing enough people. So Sam, you can go on to the next slide. This tab here, so you can see we have 6 tabs at the bottom. So this test per day chart, it shows you the lines for each of those numbers. So this red line here is the percent positive tests, and this is the 7-day or the 14-day rolling average. So this shows you just as time has gone on, how many tests have been positive in the last 14 days. So you can see here for Georgia, you can select your state in the top right. And Georgia, it looks like they, as of May, are just getting to that, below that 10% threshold. So when this slide was updated, this was at 8.7% positive over the last 14 days. However, their total positive test is 14.8. The purple line is the number of tests per day. So this is the rolling average for the last 7 days, how many tests per day per 1,000 people are being conducted. So you can see that Georgia has had a steady increase in the number of tests per day, and that's a good thing, but you can also see they're still significantly below the recommended threshold for reopening. So really what you'd want to see is a divergence of the positive test rate and the recommended tests per day. You want to see the tests per day go up and the positive test rate should go down. Sam, you can go on to the next slide. And so here we can kind of see that happening. This is with New York. You can see that in April, the height of their pandemic, they were having almost a 50% positive test rate. And they have significantly gone down in the last month as their as the pandemic has kind of ebbed a little bit. But they are also, their testing has gone up pretty significantly, and they are pretty close to reaching the recommended threshold for the number of tests per day. But their total positive test is still at over 30%. So they still have a lot of work to do to get below that threshold. And you can see on this chart the guidelines. So the recommended test per day is that purple dashed line atop. So you want the purple line to be above that, and then this kind of peach colored dashed line, you want the positive test line to be below that line. And Sam, you can go on to the next slide. So here we have for the state of Missouri, you can see that we've been hovering around that 10% line since April or March, into March, and we've dipped below the 10% positive line, but our tests per 1,000 people is still significantly below what the Harvard study recommends, and a lot of different lawmakers and leaders of states have acknowledged as their goal is they want to reach that 1.52 per 1,000 people average for the last 7 days. So before they consider reopening. And really, these are just 2 measures. There are others that need to be considered before states reopen. But these are 2 that kind of work together. And as you see those tests per 1,000 people increase, you should see those positive rates go down. So this is kind of getting at the testing part of the guidelines for reopening, but there are still other guidelines to consider. And the NPR article that is cited in here has those guidelines kind of listed out. If you're interested, you can click that link and it'll take you to that article.
Great, thank you, Justin and Sam. So that concludes our presentation for today. We are available for questions. We have about 4 minutes left until we hit our 30-minute mark. So if anybody does have any questions about the dashboard or the information that we've presented today, feel free to put that in the chat and we'll stick around. In the meantime, just know that these data and tools are being updated on a regular basis. And so make sure you come back and sort of check to see how things have changed as you're out in your community thinking about how you're starting to address some social and economic recovery. These are really great places or great tools to be able to start that conversation and to root everyone in the most recent data that are available. And so that's what we're hoping to be able to provide to you all. And if you do happen to use this dashboard or any of our other COVID-related tools in your community planning efforts, reach out to us and let us know how you used it. We're always happy to share and wanting to share how folks are able to use these data in real community situations. And I think now more than ever in this current situation, it's great to be able to share those successes and those applications across all of us. So I don't see any questions coming in, so we'll stay here on the line for the next couple of minutes, but thank you all for joining us today. As mentioned, the recording of this will be available. We'll follow up with an email to you all with this recording, and if you do have any follow-up questions, our emails are here. Also, our emails are available on allthingsmissouri.org, so don't hesitate to reach out. We hope that you have a great day, and we'll see you on our next webinar.